Hi, I'm Chip Myers, a paramedic with the City of Alexandria Fire Department in Alexandria, Virginia. Next, we're going to talk about how to treat somebody with an extremity fracture of the lower leg. Over here we have Josh, who's laying on the floor complaining of pain in his leg. He's got a swollen area in his leg. He felt a popping sensation or a snapping sensation. We notice it's very painful to the touch, and there may be even some false motion or some kind of, feels like some grinding sensation when we check the area. First thing we did is we measured out 2 board splints and laid them one on the inside of the leg and one on the outside. These board splints, you can use anything you have around the house that's long enough to fit the leg, a broomstick, anything. Ideally, try to pad it with some towels or something, but if you don't have anything to pad it with, putting the splint in is better than nothing. If you have nothing at all that you can splint the leg with, you can use the good leg and tie both legs together. When splinting, you want to put 2 triangular bandages or 2 cravats, or if you use tape, anything that you use, but you want to put 2 on the upper leg and 2 on the lower leg to try to hold the splint in place. The idea is we're trying to minimize any motion in that leg, in that fractured area, and that'll help reduce the pain for this person, plus it'll help reduce some of the swelling and damage to the soft tissue as well as the blood vessels and nerves in that area. When tying the cravats or the triangular bandage, you want to make sure not to get so tight that you actually cut off the circulation to the foot. So if the patient starts saying that they've got a tingling sensation in their foot or that their foot starts to turn purple, you might need to loosen up some of the cravats. Next, we're going to talk about how to treat somebody who's got an ankle injury. Josh here has an injury to the ankle on the other foot, and we're going to wrap that in either a blanket or a pillow to try and stabilize it. You want to use something bulky, something soft. If you're at the ski slope and somebody else has this problem, you could use a down jacket. So you just position the ankle, the heel of the foot on the center of the blanket or the pillow, and you wrap it up around the foot, and you just tie it in place or tape it in place, whatever you have handy. So that's how you stabilize fracture of the lower extremity. Next, we're going to talk about how to treat somebody who's having a seizure.
To watch the other segments in this video series or for how-to videos on almost any other topic, visit monkeyseed.com.